Hi, welcome everyone. I'm welcome to DNA Dialogue. I'm Associate Professor Jodie Ingalls, and I'm have the great pleasure of stepping in for Tiff Bortwood today to chair this really exciting session that we've got lined up. I'd like to start with an acknowledgement of country. In the spirit of reconciliation, I acknowledge the traditional custodians of country throughout Australia and their connections to land, sea, and community. I pay my respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander people today. Today I'm calling from the traditional lands of the Gadigal people. So DNA Dialogue is a forum for members of the genomics community in Australia and beyond to learn about new developments in health, genomics, and overseas experience. And DNA Dialogue seminars will be held live via Zoom on the last Thursday of each month. If you're active on social media, we encourage you to use the hashtag DNA Dialogue and tag Australian Genomics into that. A little bit of housekeeping. So please ask any questions throughout the talk and at the end using the Q&A function during the presentation, and selected questions will be read out and answered at the end during the question time. And a quick note that the next, for September, there'll be no DNA Dialogue because of the GA for GH plenary being hosted in Melbourne. And check that out on the website if you haven't already, because there's some pretty cool stuff lined up for that too. So it's an absolute pleasure, one, to be asked to fill in for Tiff. That's not something that doesn't induce some anxiety, but also to introduce our speaker, someone I think that we all see as an outstanding role model, especially for those of us genetic counsellors trying to compete in this academic world. Jehannine Austin is a professor in psychiatry and medical genetics at the University of British Columbia. Jehannine is a board-certified genetic counsellor, and their research work involves studying how to improve access to genetic services for people who've historically been marginalised and working to ensure that those services are safe and effective. They founded the world's first specialist psychiatric genetic counselling service that has won an award for its impact on patient outcomes, and in addition to peer-reviewed publications, has written a book, won awards for teaching, leadership and research. Jehannine is a member of the College of the Royal Society of Canada and a fellow of the Canadian Academy of Health Sciences. And excitingly, Jehannine is now the editor-in-chief of the Journal of Genetic Counselling, and I can say with experience that they've injected so much enthusiasm and ideas into every aspect of that journal, and it's really exciting to see where that's going to go over the next few years. So in this presentation, Jehannine will discuss the importance of working as a community to develop and consolidate the recognition of genetic counselling research as a rigorous area of academic study. Jehannine will also explore, to do this effectively, we need to understand what constitutes genetic counselling research. And I'll hand over.
Awesome. That's my cue to try and see if I can find my video. Hang on. There we go. There we go.
Okay,
Okay,
I can
thank
see
you
you
very
and
much.
see slides.
Brilliant. Thanks, Jodie. Thank you very much for that lovely introduction, and thank you also very much for the invitation to be here. It's a real pleasure. So yeah, you've heard a little bit about what I wanted to talk to you all about today. I was actually asked to talk about psychiatric genetic counselling, and I kind of said, can I talk about something else instead? So this is what you're getting. So I want to talk about why it's important for us to develop and consolidate the recognition of genetic counselling as a research, as a legitimate area of academic study. But to begin, like you all, it's very important for those of us who live in the land that we now know as Canada to start with a land acknowledgement. So I'm calling in today to you all from the traditional, unceded and ancestral territories of the Coast Salish peoples. And that includes three nations, the Musqueam, the Squamish and the Tsleil-Waututh. And I am incredibly grateful to the peoples who've always called these lands home for their generosity in allowing me to be here as a first generation settler in sharing in their stewardship of this land. So incredibly grateful for that. So yes, as you've already had disclosures to begin with, this is going to come up. It's relevant to the content today, but I am editor-in-chief of the Journal of Genetic Counselling as of January this year. And a couple of years ago, I provided some consulting services to 23andMe. That's not particularly relevant, but just in the spirit of you should know everything. There it is. Okay, so let's start with some very personal, miserable stuff to begin. So why did I suggest to the people who invited me that I did not want to talk about psychiatric genetic counselling, and that in fact I would rather talk about why it's important that we consolidate and develop the recognition of genetic counselling research as a legitimate area of study? I think the answer to that is not entirely encapsulated in this slide, but it's pretty good. So what you're looking at here is a review that I got from a federal granting agency that was for my own Canada research chair, and that's like a super prestigious thing, and it's a salary award basically. So it's not for research project funding; it's to fund your salary. And this was when I went up to renew my Canada research chair. I'd already been awarded it. It was 5 years old, and now it was time to renew it. And so I submitted my package of stuff, and it was all about genetic counselling research. And this is one of the reviews that I got back. I think that her work is not really science, but mostly propaganda and academic politics. So that was kind of delightful. Because of this review, I had to go through a whole additional stage of review and was I going to get it, yes or no, etc. And yes, I did in the end. It was fine. But I think this really drove it home for me very clearly that the work that I do, the work that matters so much to me as a researcher, is not widely respected as legitimate. And that presented me as a problem in my career here with this. But I don't want it to present a problem for anybody else. Like, I would like, if we could use my horrible experience to avoid difficulties for others down the line, then I would very much like to do that. That's really the motivation for today's talk. So why this topic? My own experiences. Yes. Reviews I've received of my own genetic counselling focused grant applications. You just saw one of them. But also, and this, I'm going to speak to those of you today who may be joining us who are not genetic counsellors, but work with genetic counsellors. And despite the fact that I do recognise I may be preaching to the choir by the fact that you're here, but I also have had lots of experience as a co-author on papers with people from outside of genetic counselling. So as you know, or you may know, my specialist area has been psychiatric conditions for a long time. And just the number of times I've been a co-author on papers with people who are psychiatric geneticists or behavioral scientists or whatever, and we're writing a paper together and somebody will say, well, if only we knew something about how to communicate about risk in this kind of situation. I'm like, oh, so, so this is expertise of genetic counselors, and we've written bucket loads of stuff about it. It's just that we don't seem to cite across disciplines, if you like. So for those of you who are joining today who are not genetic counselors, hooray, I'm glad you're here. Please think about our stuff as you're writing your own papers. Thank you. Okay, cool. So it's more that, as I've said, like I've had my own experiences, but I think the issues around developing and consolidating the recognition of genetic counselling research as a legitimate area of academic study go beyond the things I've just talked about, right? Those are sort of like the surface level things. I want to talk about why it matters at a deeper level. And then I want to talk a little bit as well about how we achieve this. But let's start at the beginning with the why piece first. Okay, so I don't actually know if this is entirely true in Australia, but I imagine it probably is. But I'd like to hear from you in the chat at the end, perhaps. But at least in most of the rest of the world, if genetic counselling exists anywhere, then it's thought of in those places as primarily being a clinical profession. And I really feel strongly that to move forwards, being recognised for generating and publishing intellectually and methodologically rigorous research is going to make a difference at a bunch of interrelated levels. So it's going to make a difference for the profession of genetic counselling. It's going to make a difference for society and our patients. And it's going to make a difference for the individual genetic counsellor. I'm going to unpack that a little bit over the next couple of slides, if I can make them move forward, of course. Okay, so let's start with the profession and practice of genetic counselling and why this matters here. I'm just going to come right out and say it. Okay. Our credibility as a clinical profession depends on evidence for what we do. We need an evidence base, like evidence-based medicine has, you know, is reigning supreme, for good reason. We need to have evidence to support the things that we do with our patients. And where does that evidence come from? Research. So yeah, our credibility really hangs on this. It underpins our ability to continue to advance and consolidate our positions as leaders in the implementation of genomic medicine clinically. And, you know, in other places in the world where genetic counselling is yet to be established, really it's the research evidence showing the outcomes of what we do, and the need for what we do that allows those places to move forward in establishing services. So, yeah. So I think one of the things that when I'm talking to genetic counselors who work clinically, um, there's often a sense that, well, research doesn't really matter to me. And I want to try and fix that, I think, because I think it is a thing to fix. It does. It matters in how we interact with our patients, but I also get the sense that we often don't feel as valued in our clinical spaces, as I would argue that we should be, to be quite frank. And I like to imagine that if we had greater evidence underpinning the things that we do clinically, then that might give us collectively more confidence as a profession, to really stick our necks out there and say, no, this is why we do what we do, and this is the evidence that what we do means something. And I like to imagine that that would help us to feel and be valued. So taking it to another level, why does it matter at the level of society or patients? Well, as we've already alluded to, we're best able to help patients clinically and to contribute meaningfully when what we do is guided by research evidence. Um, so it feels to me like the future of our services being available to patients depends on generating evidence to support and guide what we do. Um, I feel at the moment that we're in a bit of a watershed place again. It feels like these happen fairly regularly. At least in North America, in terms of what's happening with the genetic counselor job market. What we're seeing is incredibly long waiting lists for people to be seen clinically by genetic counselors in tertiary care centres. But new positions are not necessarily being created. So but at the same time, there's still this rhetoric that there aren't enough genetic counselors, that's pervasive in the medical community. And I think the reality of what's underneath it is that maybe there are actually enough genetic counselors. It's just that they're not being hired, the positions to employ them are not being created in the clinical service spaces that we need at the right level yet. So and this is something that, you know, came up when I was NSGC president like 10 years ago, essentially. It was just something that came up when I was looking back through documents and things that I'd read in preparation for talking about this stuff today. And this was something that I said back then, that still really makes me feel very strongly today. Like, you know, you can make an argument that, well, does it really matter if genetic counseling carries on as a profession? You know, like, sure, for you and me, maybe it matters, like it's our paychecks and so on. But I think it's way bigger than that. Like, to me, this is still true. Allowing the extinction of our profession would be a profound disservice to patients and the future potential patients who stand to benefit from what is a unique skill set and perspective that we have. And then it also matters that genetic counselling is recognised as a legitimate area of academic study at the level of the individual genetic counsellor. There are some of us who are in tenure stream research positions, and as you've heard already, that's affected me, like my research not being taken seriously as a legitimate thing, almost impaired my ability to renew my Canada research chair. And the number of people in positions like mine is increasing, and that is an awesome thing. And I will hope to tell you a little bit more about why I think that's awesome later. Um, so, oh yeah, the other thing I want to say, the other airing dirty laundry piece of information I want to share with you here is that not only did I have the Canada Research Chair renewal experience that I shared with you already, also the first time I went for promotion to full professor at my institution, I was unsuccessful. And the reason that I was unsuccessful was I was told that my H index is not high enough. So H index is a way of measuring individuals, researchers, and it's simply a function of how many publications do you have and how many times have they been cited. And what we know about H-index as a metric is that it's incredibly biased. It's got sexism baked right into it. And it's also problematic for people who are in research areas which are not very well established yet. H-index is also very strongly tied to your age. So the older you get, the higher your H-index becomes, even if you don't publish more papers, just because they've had more time to be cited. So anyhow, despite rebutting the letter from my dean with all of that evidence, my promotion to full professor was not successful the first time round. It was successful the second time round. But again, like, I think my approach to life in general is to try and channel the disappointments and frustrations and pain that I've experienced in various ways into trying to make things better for the people that are coming up behind me. So even if this is not you, even if is that you're not in a tenure stream position and you're thinking that doesn't really matter to me, it does. Like, I think when one of us succeeds within our profession, we are all collectively succeeding. So I take that sort of collaborative, collegial sort of approach to things. Yeah. So yeah, and then advancement for people in tenure stream positions is really hard if your stuff isn't recognized as being legit, essentially. Okay, so I'm going to take a breath, and hopefully I've convinced you that for a variety of different reasons at interrelated levels, it does actually matter that we should try and consolidate, develop this things, right? So I'm going to assume that I've convinced you of that, and I'm going to move on to the, well, okay, if that's a thing, how do we do this? So let's start talking about that. So as I was thinking about this, the most obvious answer that comes into your head, of course, is, well, we need to conduct and publish high quality genetic counseling research. And then maybe as well, we should probably also ensure that it's being shared with and read by people other than genetic counselors. Those are kind of like the obvious things. And so I was like, great, got that solved. That's what we need to do. Awesome. But then my next thought was, but how do we recognize and define what constitutes genetic counseling research? So literally what I'm going to do with you in this talk is share with you my miserable thought process that I went through as I was trying to sort of articulate some of these things for myself. So join me on my journey of misery. Okay. Okay, let me see if I can switch my slide here. No. Okay, so I started concocting different ideas for how we might propose to recognize or define genetic counseling research. And I'm going to share my thoughts with you here. Okay, so I thought, well, maybe is it any research that's conducted by a genetic counselor? And then I was like, but I'm a genetic counselor and not all of my work falls under the umbrella of genetic counseling research. So no, maybe not that. And then I was also thinking, well, there's lots of people I know who are not genetic counselors, but do awesome genetic counseling research. So that doesn't work either from that perspective. So that one's out. That can't be it. What about research that is about genetic counselors? Well, for those of you who are genetic counselors, you will know that genetic counselors love studying other genetic counselors. And while that can be useful sometimes, it certainly should not be the entirety of the scope of what we do in our research space. So not this either, no. What about research that is about genetic counseling? What does that mean? Like, and that worries me a bit because it's like, are we just talking about outcomes research then, I suppose? It's about more than that. Like, it has to be about more than that. What about need for genetic counseling and so on? I can see the chat box thingy going bing bing, and I hope it's people being outraged or reacting or having their own ideas. I can't see at the moment. So I'm just going to tell myself the story that that's what it is. What about defining genetic counseling research as being something that's characterized by using a particular method or a particular approach to things? Now, that initially had some appeal, but I am a researcher who uses, for example, both qualitative research methods and quantitative research methods. Sometimes I even use mixed methods. And the idea to me that I would have to abandon or lose any of those things was horrific. I don't want that to be how we no, all of those different modalities have incredible utility in the context of genetic counseling. So that one was out for me too. What about research that has a particular goal? Is that how we could define genetic counseling research? I don't know. It'd have to be a fairly vague and nebulous goal. So kind of, I rejected that one too. And what I ended up with, the last one that I didn't entirely reject was What about research that is defined by some sort of central worldview? That sort of felt like it had some sticking power for me, but I wasn't entirely sure by what I meant by worldview, really, essentially. Values and principles, beliefs, I suppose, was what I was thinking of. So that led me to this point. So I don't think we can define genetic counseling research without first defining what's genetic counseling and articulating its core values and founding assumptions. All right, so that's really the sort of worldview piece, that second point there. Now, I know I'm leading you on a bit of a wild goose chase, but this is literally like my brain process. I hope you're following me. And it totally makes sense to me as a series of events. I hope it does to you too. So let me just take a pause for a second and share with you why defining these things matters. And I'm going to do that by sharing this quote with you. And this is actually from an author who's a nurse. And they say, without a clear disciplinary orientation and foundation to guide the development of the profession, it's easy to lose the way. The nursing profession, without the disciplinary foundation for knowledge and practice, can easily be guided by a hospital culture and pressure to conform to the medicalized, clinicalized views of humanity. And when I read that, and that little QR code will take you directly to the paper if this is of any relevance to you or interest and you're a nerd like me, that's where it will take you. But when I read this, it really hit me that you could take out the nursing profession and replace it with the genetic counseling profession, right? And the other thing that hit me was that this stuff about can be easily guided by hospital culture and pressure to conform, blah, blah, blah. We're already seeing this happening, at least in North America. What we're seeing, I worked with a student who published her thesis work last year, which basically showed that in tertiary care medical centres, the creation of new jobs for genetic counsellors is driven by, it's not surprising, but it's driven by demand from physicians who want to refer. And what drives physicians to want to refer to genetic counselling is the availability of genetic tests, right? Because that's what we're associated with. So despite it doesn't matter if we as a profession see ourselves as being more than just communicating about genetic testing. What's driving the creation of positions that we fill is genetic testing and its availability, which is being driven by physicians. So yeah, I think that there is some work that we need to do in order to be able to resist these forces that are at play in terms of externally trying to shape who we are and what we do and what our role is in the healthcare system. Yeah. Oh, the other thing I want to say here is that I do think it's super important to point out that lots of the writing that has been done about what is genetic counselling, etc., has been written by people from North America, Australia, the UK. And genetic counselling happens in far more places than that. So I think if we were going to have a unified idea about what constitutes genetic counselling, it would be really good if it transcended geographical barriers. Like when we think about nursing, there's a set of qualities that I think we innately associate with the profession of nursing, no matter where in the world that profession is being practiced. And I think in order for it to be useful, we would need something similar for genetic counselling. So we've got some work to do in terms of internationalization, I think. I'm really having trouble advancing my slides. Okay, so now I want to talk a little bit about those core values and foundational assumptions that underpin genetic counselling. Do we have some? This was where I started. And I realized that, yes, we do. We have some. And we usually refer to them as tenets, the tenets of genetic counselling. I do not know why we use that word. It's not an easy word. And speaking as the editor of the journal, I can tell you that people think that tenant and tenet are the same thing. They're not. And then, you know, that gets confusing when you're trying to write in a way that's meaningful. So tenet means principles or beliefs. And I thought it might actually be helpful to separate those things out, that principles and beliefs have different qualities to them, and it might be useful to try and separate them out. So that's essentially what I've tried to do here. And the 3 QR codes at the bottom will take you to some of the real key foundational pieces of writing that I've been drawing on as I look at these things, together with scopes of practice and so on from organizations around the world that I've had access to. So one of the foundational assumptions that I think we have as a profession is that genetic information has value. So people don't choose to be a genetic counselor if you don't believe that, right? Like you would choose to be some other kind of helping profession. But genetic information has value has to be one of our foundational assumptions. That's in purple, if you can see the color difference, because it's something that comes up in a variety of those different places, the McCarthy-Veitch paper and the Biesecker paper in particular. The second foundational assumption that I came up with was that words have meaning and we need to use them carefully. So what I mean here is that in genetic counseling training, we're often told, and we often learn that there's a difference between saying there's a risk and there's a chance, that there's a difference between saying there's a mutation and there's a variation. And those things matter to people in terms of how they land emotionally. So yeah, so we need to be careful in how we use our words, and that seems to be a foundational assumption. Another one is that we seem to assume that humans are not purely logical beings, that emotions matter. And again, that's something that's come up in some of these other pieces of writing. And that patients or clients, however we want to refer to them, are capable and resilient, but as humans, we all need support at certain times in our lives. So that's what I classified as the assumptions. And then I separated out some values. And every time I look at this, I'm not sure I've done it right or that it could have been done a different way. But nevertheless, I'm going to share it with you just so you've got something to react to. Okay. So values, person-centeredness, right? This is absolutely foundational to almost any writing I can find on the topic of what is genetic counseling, that it's supposed to be patient-centric, that relationships matter. And by this, I don't just mean the patient counselor relationship. I mean that as genetic counselors, we recognize that the individual that we're counseling in front of us is part of a network of relationships outside of that room, that they have family, that they have loved ones, that they have community, and that the content of our conversation that we might be having with them for that 1 hour time period is maybe going to affect people outside of the room and other people that they have relationships with. So that's a value for us. Clear communication. And to me, this relates to the one on the left there that says words have meaning. But I think what we value, so the assumption is that words have meaning, but the value attached to that is that therefore clear communication matters. And so by this, I think what I was trying to get at least, is that we want to be as accessible in what we're providing to as many different types of people as we can possibly be. And we need to make sure that, we're making sure that there's as little room for misinterpretation as possible. Inclusion, equity, and justice. This is something that's come very much to the front and center over recent years. And again, it relates to what I was just saying in terms of clear communication. Like we need to make sure that what we're doing is available to everybody. And then finally, and I think this one is probably one that many of you would have thought of first, is the one around we value individuals' rights to make informed and relationally autonomous decisions about their bodies and their health. Okay, so I would be super interested to have discussion about this at the end, because yeah, so I've had some interesting discussions about people around this over here. Yeah, and I'm going to talk in a second. If you're going, where's non-directiveness? Don't worry, that's on the next slide. Okay. But the other thing it just occurred to me that I didn't specify here is that when I'm saying, does genetic counseling have core values and assumptions, I mean the profession of genetic counseling. Because the thing is that sometimes we use genetic counseling as language to describe the interaction that any sort of healthcare provider can have with a patient around genetic information. And so I'm trying to distinguish between those kinds of generalized conversations about genetics that anybody could have with a patient and what it is that genetic counselors who are specifically trained bring to things, right? That's what I'm trying to unpack here. Sorry, I should have mentioned that earlier. Hope that makes sense. So let's do the side note about non-directiveness. So you can't be a genetic counselor and not have come across the concept of non-directiveness. It's not possible. However, I hate it as a concept and as a set of words. For so many reasons. I'm not even going to bore you with them all. So many people, so much smarter than me, have written so many awesome things about why the concept of non-directiveness is just useless in terms of defining who we are and what we do. Okay, everybody, even Seymour Kessler, right? Everybody's done this. And it really but when I was thinking about why I hate it so much, it really comes down to this thing around, well, words really do have meaning, as I said on that previous slide. And I think that's one of our core assumptions. And if that's true, if this is one of our core assumptions that words have meaning and we need to clearly communicate and say what we mean and so on, this set of words, non-directiveness, is problematic because there is no universally understood meaning of the term. People use it to mean all sorts of different things, and because it lacks definitional clarity, it can lead people like genetic counselors to try and operationalize it in ways that are actively harmful. Example, patient comes in and is trying to make a decision about whether or not to have an invasive prenatal test that carries a risk of miscarriage. And this is the first and only time they're going to face this decision. It's all entirely new to them. And they ask you in desperation, what should I do? And your response as a genetic counselor who's practicing non-directively is to say, well, I can't tell you what to do. That's your decision. Oh, if we're person-centered, that is just slamming a big fat door on that patient in distress in that moment. There are much better ways to try and handle that question than, I can't tell you what to do with that, that's your decision, right? And so this is one of the, and I've seen students do this, and so this is one of the reasons that I really am quite allergic to the concept of non-directiveness. And I think one of the other things is that we are not, cannot be, and should not strive to be neutral purveyors of information. That's not possible. If we're to try to embody our core values and assumptions with integrity, we can't do that. And that is the way in which some people try and interpret non-directiveness, is just that I am literally just a sound. I am just making sounds at you. I have no values on this. Like, no, that's we're humans. This is not true. Okay, cool. So all of this to say, just to bring us back on track, the whole point of this is that we're trying to figure out how to recognize and define genetic counseling research. And then we went down this whole rabbit hole around, well, how the hell do we do that? Maybe we do it, maybe we can define genetic counseling research by research that's sort of underpinned by a central worldview. That means articulating core values and assumptions. So that's what we've just looked at. I thought this bit was going to be easy, defining genetic counseling. Yeah, we got that. We've got a definition. I've seen it on your guys' website. I looked earlier. It's right there. It says, genetic counseling is the process of helping people to understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease. So this is the currently endorsed definition of genetic counseling by the National Society of Genetic Counselors. It's from Bob Rester et al. 2006, so it's quite old at this point. And so as I said, I was like, oh, this part of the thought process is easy. We have a definition of genetic counseling. But then I read it again, and I read it some more, and I thought about it, and then I started freaking out because I was like, okay, this actually doesn't tell you anything about why we do what we do, how we do what we do. It doesn't say anything about our core values and assumptions. In fact, this feels to me like it's about the activity of genetic counseling. This feels like if any healthcare provider was going to sit down with a patient and try and talk about genetics in some way, this is maybe what they would do. It doesn't say what I would do as a specifically trained genetic counselor. And then I didn't like that. I didn't like that feeling at all. So I ended up, well, okay, to give you the full story about this part, I was actually in an Uber on my way to a conference, and oh, actually, no, it wasn't that one. Sorry. The Uber driver was somebody different. No, in this context, where I actually got pushed into defining genetic counseling properly, was a conversation I had with a journalist, actually, who ended up writing a really lovely piece of stuff that barely touched on genetic counseling. But he asked me, what is genetic counseling? And I think for many of us, that's the question that we often dread. We're like, oh God, what am I going to say this time? Because you can't really use that definition, the one that's on the screen right there. Like, that's not something that you say to a journalist. It feels like not false. It feels, yeah, academic, I suppose. It doesn't really tell you very much about what happens. So anyway, I had really enjoyed my conversation with this journalist up until this point. And he asked me, and instead of like brushing it off, saying something rote like this or something trivial, I actually thought about it. And what I came out with, I was so happy with. I wrote it down and I want to share it with you here. So I said to him that genetic counseling is a process of helping people to make meaning of genetic information, right? Not just understand, make meaning. That's different, right? It's about helping people make meaning of genetic information and helping them to use that information in alignment with their values, needs, and wants to manage their health in the context of uncertainty. So the reason that I decided I like this was because it tries to say, or at least what I was trying to do was trying to articulate some of those core values, and the why, in terms of why are we doing those things? Why are we trying to help people understand and adapt to the medical, psychological, blah, blah, right? So to me, that's what we as specifically trained genetic counselors do. So I'm not offering this as like the definition. It's something for us to react to think about. I want to spark conversation with all of this. It's not the end of a conversation, it's the beginning of a conversation. That's the idea. Cool. So where does that leave us at the moment? So to establish genetic counselling as a legitimate area of study with academic credibility, what we decided very early on here was that we need to conduct and publish high quality genetic counselling research and ensure that's being shared with and read by people other than genetic counsellors. And that's what led us down this whole thing about like, how the hell do we define genetic counselling research in the first place? We got to this definition issue around, well, genetic counselling, and the definition issue around foundational values and assumptions. So I've tried to make the case that genetic counselling research can't be defined by who does it, because you can do great genetic counselling research as a non-genetic counsellor. And just because I'm a genetic counsellor doesn't mean all my research is genetic counselling research. It can't be defined by the methods used. I use qual, quant, mixed, everything, or goals necessarily. Yeah, but rather to recognise and define genetic counselling research, we need to define genetic counselling as a profession and the foundational assumptions and core values on which it rests. So assuming all of that, I found a beautiful definition of health services research. Again, the QR code is going to take you directly to that source. And I adapted it to apply to the genetic counselling space. And please, I'm just going to say this over and over again. This is not job done. I'm presenting this to you for reactions, for discussion, for dialogue. It's like, this is DNA dialogue. This is what we do. So, so genetic counselling research is an area of study that is rooted in a set of core values and assumptions, the ones we just looked at, or something similar, that pragmatically applies a variety of paradigms to examine need for, access to, and the use, costs, quality, delivery, organisation, financing, and outcomes of genetic counselling services to produce new knowledge about the structure, processes, and effects of genetic counselling for individuals and populations. Yeah, that's a long, unpleasant sentence, I know. So this isn't the way it actually ended up coming out on the Journal of Genetic Counselling scope page, the new scope statement that we developed, but these principles are in there. Okay, so yeah, I want you to it's just to think about, essentially. All right, so let's get on to the next piece then. So then how do we establish the recognition of genetic counselling as a legitimate area of academic study? Well, okay, so what we've decided is that we need to conduct and publish high quality genetic counselling research and ensure it's being shared with and read by people other than just us within community. So I've got a bunch of things that we can all do to try and help move this agenda forward if you are so inclined. I'm going to start with established researchers, and I'm going to say a bunch of really obvious things that you're all doing anyway, but it's just nice to have it reconfirmed. Okay, so for established researchers, it really matters that we use high standards in designing and conducting our research. So, you know, when like official standards exist, like, you know, why is my brain blanking on everything right now? But like consult guidelines and so on for randomized control trials, that we use those and that sort of thing, right? So standards, high standards matter. And share your fab papers. Make sure that you're getting them out there. Yeah. And as we're doing so, making sure that we're trying to mentor and teach and support others in the research and publication process. The little QR code here takes you to a paper that describes the academic publishing world is not lacking in problems, let's say. So this particular paper, though, takes you to this QR code will take you to a paper that talks about how different publishers have different types of challenges associated with them. And so it's basically just to try to encourage us to think about where you publish. There's some publishing houses, for example, Frontiers and MDPI, that have been so consistently identified as having problematic practices that some academic institutions actually don't allow researchers to count papers that they publish in those forums, like towards their promotion and tenure processes. So, and this is not, please know that this is not a scold. If you're sitting here saying, oh my God, well, I just published my last paper in Frontiers in Genetics, that's okay. We've all done it. I totally have, even in the last couple of years. But it's just things that we should be aware of, that's all, so that we know, informed decision making is really the deal. We are genetic counselors after all. And also, if you're an established researcher, yes, I am begging you right now, as the editor-in-chief of the Journal of Genetic Counselling, please agree to review manuscripts. We need your expertise, please, please, please. Yes. And then consider your citation practices. And so, we're all building on the existing body of work that's gone before us. So please make sure that you're citing it appropriately. Yeah, it really does matter in the end for appropriate recognition of people's work. Emerging researchers, find those people on the left, find those established researchers to be mentors for you. And I know from having talked to so many people over the years that people are afraid that, oh, well, that person's so busy, they don't have time. I wouldn't dream of approaching that person to be my mentor for research stuff. Let me just tell you that, to me, mentoring people in the research process is one of my favoriteest things that I can do. Like, literally, it's why I became editor-in-chief of the journal, because it allows me an official forum in which to help authors make their papers the best that they can be. I can mentor reviewers in how to do good reviews. Do you know what I mean? Like, I can do it all. So please don't assume that those of us that you might look to as mentors wouldn't want to mentor you. I know I'm not alone in my weirdness of thinking it's one of the most rewarding things that I do. So please, reach out. Please do. Yeah. Learn as much as you can. And what I mean here is that a thing I've noticed as editor-in-chief of the journal is that we have a tendency to use other published papers almost like a recipe book. And say, well, this paper did it this way, so I'm going to do the same thing and write it up the same way. But it might not always fit quite as well in your particular situation. The assumptions underneath the methodological choices, for example, might not fit as well. So you really do have to be thoughtful about not just how to do things, but why to do things. So yeah, I've got lots to say about things like the concept of saturation, if you're using a qualitative research approach, for example, inter-rater reliability, if you're using a qualitative approach. These things often don't work. It's methodologically incompatible. Be delighted to talk more about that at the end if anybody's interested. And then for educators, for anybody who are involved in educating, quality supervision for trainees for their research projects, research methods education, and quality journal club discussions. Journal clubs can either be great or kind of useless, to be honest, and I think we've all experienced both. Well, if you're lucky, you've experienced the good ones. So yeah, having good quality discussions around papers that are relevant to our area, I think can be a really informative strength building thing. So yeah, so there are like resources that we can lean on in the design and publishing of work to try to make it as high quality as we can. And I'm only going to highlight a couple of things here just as a little introduction to some of the beautiful things that already exist in our community. So this QR code will take you to some lovely work by Debbie Cragen and Heather Zierhut, which is looking at how to think about outcomes research in the context of genetic counselling. They lay out a whole model. They've got a whole bunch of validated measures. Like, if you're interested in genetic counselling outcomes research, this is the website for you. Please take a screenshot of, or whatever you do with this QR code. It's an awesome like resource if you've not used it before. And then if that's the kind of research you're doing, genetic counselling outcomes, did you know there's actually some reporting standards for how to write up those papers? And so this is one of those papers, you know, sometimes you have really bad, I don't know if anybody else gets this. This is the paper that I had FOMO about. This happened when I was NSGC president. I got the group together and I so desperately wanted to be part of it, and it really was not my role at the time. But anyway, so they did awesome work. Still sad that I wasn't part of it, but yes, so that's there for us to use when we're reporting our studies. And then from one of your colleagues, Daniel Veers, this awesome paper on inductive content analysis. So I've been sending this out to lots of people who are submitting papers to the Journal of Genetic Counselling. I don't know if Daniel's here, but thank you if you are for writing this awesome piece of work. Because I think it's been really helpful for lots of authors. We've got stuff on grounded theory. We've got stuff about how to think about qualitative methodologies in general. And that's just to give you a little snapshot. That's really all I'm doing here. I want to finish with telling you a little bit about what I see as being the role for the Journal of Genetic Counselling in trying to push this agenda that I've mentioned of trying to develop and consolidate the recognition of genetic counselling research as a legitimate area of academic study. So we've refreshed the scope for the journal. Go have a look at the website if you haven't lately. It's all very exciting. It's along the lines of some of the things I presented to you today. And we have a refreshed, very much more international editorial board. So Jodie, who introduced me today, is a member of the editorial board. Thank you, Jodie. And we've even got trainee positions on the editorial board now, which I'm very excited about. We've got 5 people currently in those positions, and more to come. We're focusing really hard on helping authors to more rigorously describe their methods. And one of the ways in which we're doing that is if you're writing a piece for the Journal of Genetic Counselling and you're like, you know, how do I do this, that, or the other? Then you can contact me. You just email me and you say, can I have an office hours consult, please? And depending on what the specific questions are that you have, I will convene a group of members of the editorial board to meet with you via Zoom. And we can talk about constructively how to, you know, ensure your paper has the best chance of being favorably reviewed as quickly as possible, essentially. We're offering mentorship to reviewers. So if you're keen on getting engaged in reviewing, but you're like, oh, but I've never done it before, that's okay. Log into Editorial Manager, sign up with your areas of expertise. And when you get an invitation to review, I can fix you up with a mentor on that review. I just did 2 mentor sessions for new reviewers today. It was very exciting. We have a special issue on research methods coming out soon. I'm going to share a slide on that in a minute because I'm so excited about it. And we this one I'm really embarrassed about. Not the podcast is awesome, but we called it DNA Dialogues because we didn't know that this existed. So I'm very sorry. It's DNA Dialogues, not dialogue. Anyway, the point of that is to increase the reach and the visibility of our work. So here's the info about the special issue that I just mentioned on research methods in genetic counselling. So hopefully this will be a great guide for you all to use. Melanie Myers, Hitanshi Naik, and Tasha Weinstein are co-guest editing that one. And then this is our podcast, as I said. But the QR code will take you directly to where you can listen to to this on anywhere that you usually get your podcasts from. And our 7th episode is about to come out. Literally, I'm launching it tomorrow. So yeah, that's some of the things we're doing at the journal to try and increase visibility. So what I want you to take away is that I think it really matters that we establish the recognition of genetic counselling as a legitimate area of academic study. To do this, we need to be clear about our foundational values and core assumptions in the definition of what we do as a profession rather than just as an activity. And we need to be conducting and publishing high quality research and ensuring it's being shared with and read by people other than just genetic counsellors. And yeah, I've tried to share with you a little bit at the end about what I'm trying to do in my role as editor-in-chief of the journal. But I would love if you would join me in these efforts to try and get ourselves recognised appropriately as we should be. And with that, I will see if we've got any questions at all. And that's my email address in case anybody does want to reach out for like journal, office hours, consults, etc. Yeah. So thank you very much for listening. I'm going to stop screen share now and have a look at the Q&A box. Okay.
Amazing. Thanks, Jane9. That
No,
was incredible. I can tell you that my team, the GC channel in our Slack is just going off. I've had to try and mute it because everyone is very excited and basically gushing about your talk. So there are quite a few questions, but I'm actually going to jump in first because that's my prerogative. I mean, I think it's so thought-provoking. It's actually really nicely, really nicely structured, a whole lot of thoughts, which actually really do get you thinking about what we're doing. One of the other issues that, I mean, I've been doing this for 20 years, and one of my challenges has been not just how do I convince academia and medicine about the value of what I do, but how do I actually convince the profession that I belong here to?
yes, yes,
And I once
yes.
got told really early on by someone from I think the Board of Censors, it's okay, you'll get a real job soon. And I thought, well, actually, I really like my job and I love the fact that I can not help the one patient in front of me, but, multiple around the
I
world. And
know.
I guess I stuck to my guns, but I left the profession basically for many years because I thought, well, this is too hard. I can do what I need to do without
Yeah.
being part of that. One of the things we're really struggling with in Australia is how can we best support academic GCs and genetic counselling research. And there is huge amount of goodwill and a lot of PhD students and postdocs
Awesome.
and group
Yeah.
leaders, at all stages of academia now. It's actually in Australia a real force. I mean, have you got any thoughts from from Canada or other parts around the world where the profession can do as good a job as possible to support this?
Oh God. Yeah, I mean, okay. So I think there's some very sort of like low level practical things. So one of the problems that I had with my promotion application was that so as I said, like the value of my work was not recognized. And part of the problem was that I was supposed to have 4 arm's length reviewers who were at the level of full professor in research intensive universities, and there weren't any who were genetic counselors, literally, right? So I ended up having my work reviewed by people who are not in my field and therefore didn't see the value. So one of the things I'm doing is, please don't take me at this face value. I'm literally saying yes to every single request to do like promotion tenure reviews for people that I get. And I've done 6 in the last 3 weeks. Like it's been a busy year. Yeah, it's been a
Wow.
busy year.
Yeah.
So I think there are those kinds of things that we can do to support
Yeah.
each other. But like you, Jodie, I've been told as well, it's like stab my heart, why don't you?
Yeah.
Like somebody literally said to my face, well, you're not really a genetic counselor anymore, are you?
Yeah.
This was as I was putting in my application to be NSGC president. And so that was the reaction was like, oh, why would you do that? You're not really a genetic counselor anymore. And I'm like, what?
Mm.
Like the entirety of my reason for being is to try to like advance what we do so that more people can benefit from our clinical services. Do you know what I mean? And
Yeah.
like, yeah, just stab my heart. Yeah. Anyway,
No, 100%. And that
yeah.
actually maybe ties into the first question from Laura Yates. And add your questions into the Q&A. We'll see how many we get through. How do you continually pick yourself up and keep going after all these roadblocks and negative
Oh.
feedback? Do you have advice for when the system seems against us?
Oh, it's so hard, Laura. Yeah, no. So no, it's so hard. And like I know most of you know this already. Haven't specifically told you all today, but like I do live with depression and anxiety. I take medications every day that help me a lot with that. But so especially given that that's the the background on which I just live my day-to-day life, these sorts of roadblocks and negative events can be really impactful, especially when your work means as much to you as mine does to me, and as you were saying, yours does to you, Jodie, right? So it is really hard. So I think one of the things that compounds difficulties for me is shame. So as you've seen, I let all my dirty laundry air for because to me, exposing it to sunlight, sharing it with other people takes away the shame aspect of things. If I'm sharing it, I'm taking control of it and it can't be used to shame me. I will not be shamed. I want to try and learn from the things that I've experienced. I want people to know. I know people look at me and think, oh, that J9, they're so successful. Like, yeah, that's the bit you see, right? The bit that you see is supported underneath by a whole iceberg of things that have not worked. Yeah, so I think that's really important as well, just to normalize things, that nothing is, it's not you. It's absolutely not you. This is what we all face. Yeah.
Yeah, agree. And I think that helps as well when we all share that, because it helps the
Yeah,
rest of us not feel so
that's
bad
right.
about our own lives.
Yeah.
Okay, we've got a question from Lisa Ridgway. Um,
Lisa.
is there a role for patient partners in genetic counselling research?
No, Lisa, not at all.
No.
So Lisa and I work together actually on a pharmacogenomics project. I'm delighted you're here, Lisa. And so yes, absolutely. And it wasn't something that I really focused on today, I'm afraid, as you noticed. But yeah, I think that in the research method special issue that I was talking about, we've commissioned a piece which is on patient-oriented, patient-engaged research, because this is so important and we're not doing enough of it yet in our profession. We should be. So yeah, I think absolutely, Lisa. Absolutely, yes.
Excellent. A question from Danny Gezi, who's a brilliant GC student in Adelaide. As an upcoming genetic counsellor, many people that she comes across has never heard
Yeah.
of our profession, including many other allied health professionals and clinicians. Does this contribute to the attitude and recognition towards GC research, and how can we promote awareness of genetic
Oh,
counselling? Genetic
Danny, I
counselling?
know. Oh my gosh. And it's so disheartening, like, especially amongst other healthcare professionals, when you're talking to people and you're like, really, even you don't know what a genetic counselor is. Yeah, so that is obviously, I think, sort of a fairly substantive problem. What I'd say is even more of a problem is when people have heard of genetic counselling, but they've got completely wrong ideas about what it is. So for us over here, so Jodie mentioned in the intro, the psychiatric genetic counselling clinic we started here, that was actually closed last year. But at the beginning, we were talking about it as psychiatric genetic counselling. And what we were finding is that the psychiatrists they understood what we were doing and they were like, this is awesome. We're going to send you all our patients. And then they didn't. And so we'd meet them with them monthly and we'd say, like, why are you not referring your people? You said this was awesome and you would refer everyone. Nobody's come. And they'd say, oh, yeah, we just keep forgetting. And so we did this whole dance around trying to find ways to help them remember for months. And then eventually, 6 months or so down the line, we were like, what gives? We've done everything you've asked. You're clearly not just forgetting what's going on. And they said to us, well, actually, we just don't feel comfortable referring to people to something called genetic counselling. We're afraid it makes it sound like we think our patients shouldn't have children.
Wow.
So, yeah. So we were like, okay, fine. What would you be comfortable referring your patients to? And they said, well, what you're really doing is helping people adapt, right? So why don't you just call it the Adapt Clinic? So that's why we called it the Adapt Clinic. So I would say that unawareness of genetic counselling is a problem, but also thinking that you know what genetic counselling is and being wrong is also a problem. So yeah, we do need campaigns or something around this, I think. Yeah, yeah.
Yeah. And maybe on that note, if someone wants to post some of the GC Awareness Day links, I know in Australia, or well, actually Australasia, as we are for our society, we do quite a lot on Genetic Counselor Awareness Day. So that's also a really good way to order a shirt and order shirts for your whole family. My dad's got I'm a genetic counselor t-shirt that he wears quite a lot. So there are things like that as well that help start the
Love it.
conversation. Thanks to Sarah Medlin for adding some links about
Sarah.
counselling courses. Kirsten Boggs, how do we as research GCs engage with clinicians, others who aren't GCs? Most would feel that our research is not relevant to them.
Well, I think sometimes, so again, sometimes it's related to what we were just talking about, is that people don't actually know what genetic counselors do. So as I've said, like in my psychiatric genetics space, um, I guess initially it surprised me that people didn't necessarily know that we were experts in communicating about risk. Like I now understand that that's a thing that people don't necessarily know about us. But initially I was like, wow, how would you know? But how would people know that really if we're not out there telling them? So yeah, so I think with all of these things, it's often finding out what are the needs that the people that you're talking to have, And then how can you pitch who you are, what you have to offer in light of what their needs are? And then, by the way, did you know that's genetic counselling? You know, so, yeah, it's Danya says she's here. Hi, Danya. Yeah.
Yeah, I've made all of the questions and comments live so you can see them all in there. And I can see that
Awesome.
another person, Hannah Byrne, who I think is coming to our group next week as a student. So we can maybe answer your question then. But we're at time. So just want to say an absolute, very sincere and huge thank you to Jehannine for that brilliant talk. I mean, that would have been no simple feat to get all of that together into a coherent set of slide deck like that. So I'm hoping that you're planning to do more with that and put that into the public domain in some way, because I'm basically sold on the definition of genetic counselling and genetic counselling research. So I am
Awesome.
now adopting that in my head. So we definitely need a reference for it.
Yeah, I'll actually send you one because I put it in an editorial in the Journal of Genetic Counselling in the June issue,
Brilliant.
actually. I'll send that to you. Yeah, yeah.
Brilliant. Huge thank you. Thanks everyone for joining. It was actually fairly well attended, absolutely very well attended morning session. So yeah, thanks very much. We'll back to usual programming with Tiff Bortwood next time, but thanks everyone. Catch you all later.
Bye. Thank you for having me.